Good morning, my people. It's my hope you are having a fantastic week. Me too. I'm having a good one. Let me start by welcoming you back to my YouTube channel, whereby we continue giving you educational bangers each and every day. And it's my hope that it's helping you and changing your life in one way or another, as pertains the common health conditions in the locality. For those who have subscribed, let me start by appreciating you people, because it's not because of you that this channel is where it is at the moment. And those who have not subscribed, or those who are mark timing and planning to subscribe, make sure you do it, because something good is passing by. You are losing a lot. Anybody who is doing anything, however little it is, to promote this channel or to push it forward, feel appreciated. Let's get back to our discussion, whereby we have been tackling malaria, which is a common disease, and our main focus was on malaria in pregnancy because it affects many matters and leads to many fetal losses or child losses during pregnancy. So we started this topic days ago, and today we will discuss the subtopic about malaria prevention tips. Malaria prevention tips. To start with, no vaccines available to prevent malaria, and this is very important. Most of the diseases have some vaccines which can prevent malaria. For example, now we have a pneumococcal vaccine for prevention of pneumonia, which was not there earlier. But when it comes to malaria, no vaccines available. Talk to your doctor if you are traveling to an area where malaria is common, or if you live in such an area. For example, the tropical and subtropical areas. So talk to your doctor if you are traveling to an area where malaria is common, or if you live in such an area. If you are traveling to such an area, we always give you what we call prophylaxis for malaria. It doesn't mean that you are sick or you are suffering from malaria, but we just give you certain drug that protects you or gives you immunity against malaria when you go to such areas. You may be prescribed medications to prevent the disease. You may be prescribed or given medication to prevent the disease. These medications are the same as those used to treat the disease and should be taken before, during, and after your trip. These medications are the same as those used to treat the disease and should be taken before, during, and after your trip. For example, one of the drugs we give as prophylaxis is the SP. This can also be used to treat the actual malaria. This is what the statement means. Talk to your doctor about long-term prevention if you live in an area where malaria is common. Talk to your doctor about long-term prevention if you live in an area where malaria is common. Here you don't go give prophylaxis, but you go for prevention. Sleeping under a treated mosquito net may help prevent being bitten by an infected mosquito that can transmit the parasite to your body. And the key word here is treated mosquito net. So, sleeping under a treated mosquito net may help prevent being bitten by an infected mosquito. This reduces the chances of getting the Plasmodium parasite. Covering your skin or using bug sprays. Covering your skin or using bug sprays containing DET may also help prevent infection. Covering your skin or using bug sprays containing DET may also help prevent infection. Apply repellent. Apply repellent to clothing sprays containing permethrin. Apply repellent to clothing, and sprays containing permethrin are safe to apply on clothing. Apply repellent to clothing. Sprays containing permethrin are safe to apply on your clothing. Let us look at the WHO guidance, or what we call World Health Organization guidance for prevention and treatment of malaria in pregnancy. I've said that our main focus, or will be emphasizing more on malaria in pregnancy. So here we are looking at the World Health Organization guidance for prevention and treatment of malaria in pregnancy. So, World Health Organization recommends a three-pronged approach for malaria in pregnancy. World Health Organization recommends a three-pronged approach to malaria in pregnancy. And it includes the following. Number one, IPT, or what we call intermittent preventive treatment. Intermittent preventive treatment. Number two, insecticide nets or ITNs. And number three, prompt and effective case management. Number one, we have intermittent preventive malaria. Number two, insecticide nets or ITNs. And number three, we have prompt and effective case management. Let's start by discussing each one of these in details and know what it means. Number one, IPT or intermittent preventive treatment in pregnancy, or IPT. In areas of moderate to high malaria transmission, intermittent preventive treatment with SP or sulfadoxine pyrimethamine is recommended for all pregnant women at each scheduled antenatal care visit. Let me repeat this one. IPT or intermittent preventive treatment in pregnancy. In areas of moderate to high malaria transmission, IPT or intermittent preventive treatment with the sulfadoxine pyrimethamine or SP is recommended for all pregnant women at each scheduled antenatal care visit. This is the care given during pregnancy or during the 3 trimesters before you give birth, or during the 9-month period. The IPT or intermittent preventive treatment in pregnancy, SP dose, should be administered as early as possible during second trimester of gestation. So bear in mind that you can't give an IPT during first trimester. It's always safe to start during the second trimester or 3 months and above. Let's say the first visit, because most of the mothers start their clinic at 16 weeks, which is equivalent to 4 months. That during that time is the second trimester, and it's most safe to give the IPT or the intermittent preventive treatment of malaria. So the IPT or intermittent preventive treatment in pregnancy, SP dose, should be administered as early as possible during second trimester of gestation. Each SP dose or sulfadoxine pyrimethamine dose should be given at least 1 month apart. Each SP or sulfadoxine pyrimethamine dose should be given at least 1 month apart. That's why we give at 4 months, at 5 months, and most probably at 6 months. The last dose of intermittent preventive treatment with SP can be administered as directly observed therapy, which we call DOTS. That means you should give the client in your presence and observe her while taking the dose, because most of them, when they go home, they can just throw away the tablets and end up getting malaria. This marks the end of our video today, and thank you for your time. Thank you for being with me. Thank you for your support. Let's continue subscribing so that we may push this channel forward. Let's meet in the next video tomorrow.